Hello all, it's Dr. Ruth Dutton here. I'm a board-certified adult psychiatrist who uses metabolic and lifestyle interventions to get at the root causes of mental illness. So today we're going to be focusing on ketogenic therapy. We're going to be introducing it, talking about what is it and why does it work. So when we talk about ketogenic therapy, we're not talking about the fad weight loss diet. We're talking about powerful metabolic intervention that has the potential to dramatically change one's metabolic and mental health. So now, what is a ketogenic diet? A ketogenic diet is any way of eating that decreases insulin enough to turn on fat burning to a meaningful level. So this can be done through a few different ways. So you can go into ketosis through either fasting, extreme exercise, or restriction of calories. So if you're eating 750 calories or fewer per day, or through the manipulation of macronutrients. And this is what we typically think of as a ketogenic diet in today's culture. So most people today who say that they're on a ketogenic diet are eating a diet that is very low in carbohydrates, moderate in protein, and high in fat. And so we'll talk about the details of what a ketogenic diet really looks like in a future video, but for today, we're gonna dive a little bit more into the history of the ketogenic diet. So the ketogenic diet was originally developed in 1921 as a treatment for children with severe epilepsy. So it was observed that in these children that when they fasted, their seizures actually improved. And so the ketogenic diet was developed as a fasting mimicking diet to see if it was helpful. And lo and behold, it worked. And it's still used today for patients with treatment refractory epilepsy. So typically patients will be prescribed anti-epileptic medications first. Those did not exist back in 1921 when the ketogenic diet was developed. But if they're not effective for a patient, then the ketogenic diet is an option. So given that we use epilepsy medications in psychiatric treatment all the time, so things like valproic acid, lamotrigine, carbamazepine, Tegretol, gabapentin, among others, it stands to reason that this dietary intervention might also be helpful for psychiatric conditions. And lo and behold, we have found that it is. So now what's the science behind this? Why would a ketogenic or fasting mimicking diet be helpful for a brain disorder? Well, as we've discussed, many of these neurologic and psychiatric conditions have to do with disorders of brain metabolism or energy. So with disorders of, so we know that things like inflammation, oxidative stress, and insulin resistance are some of the main factors that are contributing to these the metabolic dysfunction in the brain that's causing these disorders. So what I want you to keep this in mind as we go through this next analogy. So I want you to think of the human brain as a hybrid engine. So most of us are walking around burning carbohydrates for fuel. However, we also have the ability to burn fat for fuel. And as previously mentioned, the breakdown products of fat are going to be ketones, and the breakdown products of carbohydrates are going to be glucose molecules. But in order to go into fat burning mode, you have to drastically reduce your intake of carbohydrates. So most of us who are consuming the USDA recommended 55 to 60% of our calories from carbohydrates are never going to be going into ketosis to any meaningful level, with the possible exception of people who are going into an extended fast overnight. And we can talk about that more in a different video. So now there are benefits and downsides to each fuel source, so ketones and glucose. So glucose produces energy much more quickly than ketones, and it is required by certain cell types, including in the brain. However, it does tend to produce a lot more of that inflammation and oxidative stress that we've talked about, and it's not as efficient. Whereas with ketones, they're more efficient, kind of a cleaner burning fuel source, not producing that oxidative stress or inflammation, but it is slower burning. And so people will notice that, particularly people like athletes who might be on a ketogenic diet, that they're not getting that energy boost as quickly as with carbohydrates. So we can see that when you're switching from carbohydrates to fat, it's really bypassing those issues of inflammation and oxidative stress that we've talked about that are produced when you're consuming carbohydrates for fuel. So what about insulin resistance? That's the other big one that we've talked about. Well, when we have insulin resistance, the blood sugar levels in the brain are going to increase just like they do in the body, but the insulin in the brain stops functioning properly. And so the brain cells, the neurons, are not able to utilize that sugar in the surrounding area. And so even though there's sugar available, the neurons are essentially starving. And so we call this state cerebral glucose hypometabolism. And so if they're not able to utilize the glucose, they're not able to function properly. And so when we switch from using glucose for fuel to ketones, you can imagine that this is no longer a problem, right? We're bypassing the issue of insulin resistance. So we can see another mechanism by which the ketogenic diet can address mental health disorders. Now, of course, it can be possible that someone might have no other signs of metabolic dysfunction in any of their other organ systems other than the brain. And so, one of the reasons that this might be is because the brain requires a tremendous amount of energy, and that's due to its constant firing of neurons. So it takes a lot of energy to constantly be creating the electrical signals that are transferring from one neuron to another. And it consumes about 20% of the body's total energy, even though it only makes up about 2% of the body's weight. It also has no way of storing energy. You're not noticing, fat storage pockets in your brain like the rest of the body. So this means that the brain is exquisitely sensitive to perturbations in its energy source. And that's why the ketogenic diet can be really such a powerful intervention for brain disorders. So there's so much more that we could talk about, but I'm going to go ahead and stop there for today, and we can pick up in another video. So thank you so much for taking the time to listen to this video, and I hope to see you in the next one.